Hello, I'm Brian Gresh, and this is HDtv Health District Television, brought to you by the Southern Nevada Health District. We're going to begin today with a story we only get to cover once every 10 years, the U.S. Census, which begins in March. Conducting a federal census is an exercise mandated by the U.S. Constitution so that a representative snapshot of America can be taken at 10-year intervals to accurately reflect changes in our nation's population landscape and better plan for our future. That planning impacts virtually every government program at every level, federal, state, and local, because quite frankly, running effective communities requires money. Not just for state-sponsored social programs, but for tangible things like roads, schools, infrastructure. The list is endless, and there's about $400 billion federal dollars in play.
When we try to figure out what's happening to our overall population, are we all getting collectively older? If so, that means differences in our needs for future medical care services. We need to know who's in need of vaccines and what vaccines do we need to target. And we also know that many of the conditions of public health relate to socioeconomic status and to people who have disparity and minority groups. So the more we know about how many people we have in our community, the better equipped we are to plan and to serve. The other thing is everybody knows we have a terrible economic catastrophic downturn, and so every dime that we can bring into our state to help us support our services is critical, and that's based on the census. So if people don't participate and we have an undercount of the people who are here, we will by definition not get the adequate funding to be able to provide services to the people in our community.
Let's do the math. It's estimated Nevada receives $917 a year in federal funding per person. For the 10 years each census covers, that's $9,170 per person counted. In reverse, that's also $917 per person per year lost for each and every person who doesn't take part.
What happens to the $917? Well, if it doesn't come to Nevada, I'm sure your nearby Utah will gladly grab them. So we need to count everyone. We have a very simple questionnaire, 10 questions. We figure it's going to take 10 minutes for 10 years, billions of dollars, political representation.
Why did Cardenas mention political representation? Well, going back to Civics 101, we're a nation that practices representation by population. And in Nevada's case, the numbers reflected in this year's census could mean the difference in gaining more congressional clout.
So there's a lot of stakes for the Census 2010, and I believe that Nevada may gain a congressional seat, which is huge. It's huge.
Also important to note, the U.S. Census is nonpartisan and confidential. Census workers have identification and represent no political party. Pictures of what ID workers will carry and much more information on the census is available at 2010census.gov. The census is not just for U.S. citizens. It's a way to count everyone, and by participating, an individual is not jeopardizing his or her immigration status.
The mandate from Congress simply tells U.S. Bureau of the Census employees to count everyone, whether they be citizens or non-citizens, to count them once, and to give a total to the President of the United States at the end of the year.
Census forms look like this and contain just 10 questions. You should receive one in the mail in early March. If you don't, look for one of the Census Bureau's many Be Counted sites.
And a Be Counted site is people can go, get a questionnaire, and mail it back. And we also have an operation I wanted to mention as well in some parts of Nevada where we have Update Leave, which an Update Leave is about if you have a P.O. box, because we do not mail to P.O. boxes, or we didn't get your address, we will leave a questionnaire at your household, and that starts March 1st.
The Health District's chief spokesperson, Jennifer Sizemore, explains how accurate census numbers assist in agency planning and appropriate fiscal expenditures.
In the area of public health, an accurate snapshot of how many residents of Southern Nevada we serve allows the Health District to ensure that the system has the capacity and infrastructure to provide essential services specifically tailored to our community's needs, and can also help to ensure we receive our fair share of federal funding for public health programs. So yes, it gives us an overview of how big the population is, but it gives us so much more. Population data is important for the planning of trauma and the EMS systems, as well as emergency preparedness. It allows us to better address health disparities by better understanding the changing demographics and ethnic makeup of the community we serve. And provided every resident participates, it gives us realistic data we need when it comes to requesting federal funding to promote the health, the environment, and well-being of our residents.
How do we really understand what's the impact of the changing of our population? What does that mean for our services and programs? And so we really hope that people will put aside their concerns and voluntarily basically leap to the forefront to be counted.
In the final analysis, what we're looking for is a new portrait of America.
So, as you can see, the census sets the bar for community and government planning for the next 10 years, not something anyone can afford to ignore.